So what we're talking about really here is systems advocacy. So you may have heard of individual advocacy to help carers in the work they're doing to advocate for their rights and the rights of the people they're caring for. Our work in the policy and advocacy team at Arafmi and as the peak body is all around systemic advocacy and bringing about change at a systems level. So thanks to the funding, we now have a dedicated policy and advocacy team, and our role is to gather these voices and build relationships that will help us to advocate for change where it's most needed. One of the first things that the policy and advocacy team did, and this was before I started at the beginning of the year, was to conduct consultations around Queensland so that we could get a better understanding of the current experiences and needs of mental health carers in our state. There were 83 carers who participated in focus groups at the Sunshine Coast, Brisbane, Logan, Gold Coast, Gympie, Emerald and Rockhampton. There were another 126 carers who filled in a short questionnaire, including at this forum last year and at an event out in Charleville. And then we had another 305 carers who completed an online survey. So we've taken the findings of those consultations and also drawn upon some recent research and a number of inquiries and reviews into mental health and caring where relevant to produce a report. And that report is called At What Cost? The Experiences of Unpaid Mental Health Carers in Queensland. I'm going to give you just a very brief snapshot of the key messages in there, and you will also find in your lovely green bag a 2-page snapshot that provides an overview of this report. You'll find, if you're interested in reading the whole report, there's a copy of it on the Arafmi website. So this report has been really important to Arafmi because it's a foundation for us to raise awareness amongst decision makers, service providers and the broader community of who mental health carers are, what they do, the challenges they face and what would help them most. Keeping in mind that this is a general summary of the experiences of carers more broadly across the state, these are some of the common challenges. Financial hardship. We've already heard Irene speak a little bit about that today, but we found that almost 3/4 of respondents to the online survey said that they have experienced financial hardship due to their caring responsibilities. For some, this is a result of having to work fewer hours or not being able to work at all due to their caring responsibilities. Others spoke to us about the costs involved in accessing medical support, providing transport to appointments, challenges in accessing carer payments, or the fact that they were receiving carer allowances, but it was nowhere near enough to cover the costs of living expenses and medical expenses. We also know from research and inquiries that the financial impacts of caring over a lifetime can be really significant in both terms of income and superannuation. And as we know, this impact disproportionately affects women. The next most common challenges mentioned across the consultations was the emotional impact of caring. And we found that amongst survey respondents that this emotional impact was particularly significant for those caring for a child under 15, for those who were in the first year of taking on a caring role, and I'm sure many of you remember very well what that might have been like, and also really significant impact for those who've been caring for 10, 15, 20 plus years. The impact of caring on carers' mental health was also significant, with 46% of the survey respondents identifying as having mental ill health themselves. Responses showed that the caring responsibilities impact on carers' physical health and well-being, and also many carers are concerned about what will happen when they can no longer care. You'll be unsurprised to hear that mental health system navigation and advocacy are ongoing challenges for carers. There's a need for better communication with healthcare providers and for carers to be more included in planning and decision making. carers have significant insights, as you well know, that are often overlooked, and the impacts of treatment decisions on carers themselves are often not considered by the health system. And finally, mental health carers experience stigma and social isolation and often struggle to get a break from their caring responsibilities. In terms of what people told us would make a difference to them in their caring role, the most common need was for greater recognition and support for emotional wellbeing, whether this be opportunities for more social interaction, peer support networks, professional support to maintain carers' own health and wellbeing, including support for their own mental health and wellbeing, opportunities to take a break, support for whole families. As you would well know, the impact of caring is never just on the primary carer. It actually impacts on whole families and kin groups and often whole communities. And the other type of support that people spoke about was practical support for daily tasks that they just were not able to do because of their caring responsibility. The second area that would make a big difference to the caring role is greater financial assistance to cover the costs of mental health care giving, as well as address financial disadvantage over time. Assistance with navigating systems and services, information about mental health conditions, and building skills in advocacy and self-management of health and wellbeing was another area that would make a huge difference. Unsurprisingly, lots of carers spoke to us about the need for improvements to the mental health system, including better access to mental health services, individualised care and care plans for those with mental health conditions, and cultural sensitivity and diversity in service delivery, and long-term planning to ensure the people who mental health carers support are looked after into the future. The fifth area was greater recognition and understanding of the roles mental health carers play and greater collaboration and communication between carers and health professionals. And the final area that came up most commonly was greater support for balancing work and caregiving, including for young carers. So with these findings in mind, and once again acknowledging that these are general issues and needs that we picked up across the whole population, and we're going to be doing further work to actually look at particular groups of mental health carers and are there some differences in the types of support or the types of experiences that they have. But based on these general findings, we've identified 6 areas for action that is going to guide the work of Arafmi as the peak body for mental health carers over the coming years. Now I'm going to invite you to listen carefully as I describe each of these areas, because in a moment I'm going to ask you to choose which area you might like to talk a little bit further about as part of a small group. So action area 1, raise awareness of mental health carers so that they can be better recognised and supported, is about raising awareness of the role and the needs of mental health carers within service systems and the broader public. Many people, like myself, who are supporting someone with mental ill health don't even realise that they are carers and don't know that there are supports that can help them. We figure that if we can raise awareness of individuals in the mental health system or broader systems and organisations providing services, as well as decision makers, those who are likely to connect with people who either know they are carers or perhaps don't realise they are carers can actually point them towards the services and supports that are out there. So part of this area for action will be to do further consultation and research to understand the specific needs of particular groups of carers. And we've already started doing that in areas such as what are the specific needs of carers in rural areas and also starting to build an understanding of the specific needs of carers in culturally and linguistically diverse communities. Action Area 2 is about making sure that mental health carers across the state are aware of the supports available to them, such as carer payments, support groups, Arafmi's 24-hour phone line, carer peer workers that Shannon was talking about earlier this morning, system navigators, workshops and learning activities, counselling and respite options. But it's also going to be about identifying gaps in the support available to meet the physical, emotional, social, mental health and practical needs of mental health carers, and to advocate for new or expanded supports to meet these needs. These might be supports that could be provided by Arafmi, but it also may be supports provided by a wide range of organisations across Queensland and also at the national level. So those of you who choose to participate in that discussion, we're really interested in what other kinds of supports you would like to see us advocate for. Action Area 3 is about promoting available sources of information and education and training opportunities that help mental health carers to understand mental health conditions, navigate the mental health system or the NDIS, understand carers' rights and the rights of the people that you are caring for, and information and skills building around managing our own health and wellbeing. But it's also about understanding what other information and training might be needed so that we can advocate for the delivery of new and expanded opportunities. So those of you who might join in that discussion, we're really interested in what other kind of information, knowledge building, skill building opportunities you would like to see us advocate for over the coming years. Action Area 4 is about advocating for greater recognition and involvement of carers and families in the planning and implementation of mental health treatment by health practitioners. So this covers those issues around improved communication with carers and families during periods of crisis. It might involve developing resources, initiatives that support health practitioners to better recognise carers and families, and to include them in discussions about treatment or decision-making about treatment. The area of discharge planning is one that's of particular interest to us at Arafmi already, so that we can advocate for better carer inclusion and communication in discharge planning processes. Action Area 5 is about ensuring mental health carers are aware of the available financial supports and advocating for the removal of any barriers to accessing these supports. As Irene mentioned earlier, it will also be about advocating to government for a review of carer payments and looking at other ways to reduce the financial impacts of caring on mental health carers. Looking at how we can advocate for carers to have better access to paid employment is another area that falls under this. So those of you who are interested in that area, really interested in ideas for how we might work at state, national and employer level to help reduce that financial impact of caring. And the final area, Action 6, is about making sure that the voices of mental health carers are included in decision-making about the design and delivery of mental health services in Queensland. So at the moment, the Policy and Advocacy team has been making a number of submissions to various policy reforms happening around the place, including around the NDIS, including around the development of a new national carer strategy, around human rights in Queensland and the human rights of carers. So we're really interested, if you want to talk about that area, of what we can do to make sure that the voices of carers are a very prominent part of those discussions and decision making. And I'll tell you a little bit later about an initiative that we are about to commence to help carers who are interested in advocacy work to build systemic advocacy skills and start to participate more in this kind of reform work. So, now that you know what those 6 areas are, we are interested in finding out what your priorities are for action. We've developed some initial thoughts around what we might do. I can see you now. Around what we might do based on what's come out of this report. But we're really interested in other ideas for things that we might do over the coming years, and that's what's going to happen in these roundtable conversations. There'll be 2 questions that your table facilitator will be asking you. The first one will be about any comments that you might have on the actions that we have already planned, and they'll share with you what they are. And the second one is around what other actions would you like to see us pursue over the coming years as part of our advocacy work. At the end of our discussion, your table facilitator is also going to give you a little strip of 5 little red sticky dots. And we're going to be putting up the sheets from all of the tables along these glass walls. And over lunch, you'll have an opportunity to have a look at all of the areas for action, not just those you've worked on, but those the other tables have worked on. And allocate your 5 votes to the areas where you feel is the greatest priority for you. You can give 5 votes to one action, or you might like to spread them around others, but I'll remind you of that when we get to that moment in time. So we have a number of people who are going to help us with this task. We have 2 tables that are going to look at the first area, which is about raising awareness of carers, including those who don't recognise that they are carers at the moment. And those 2 discussions are going to happen on table 5 with Tim. There are numbers on the table too. And on table 6 with Tanya, which is, yes, here in the middle. We're going to have 3 groups talking about supports for physical, mental, emotional and practical support for carers. And they're going to be at table 7 with Leah, who's just walking through the room at the moment. Table 10 with Tina, and table 11 with Cheryl. Area 3, which is all around information, training, skill development, informing carers, is going to be at table 8 with Ben, and table 9 with Nerida. There she is over there. If you're interested in promoting carer inclusion in mental health treatment planning and implementation, so getting the carer voice more strongly recognised in systems, that's going to be table 12 with Alex down towards the back, and table 13 with Simon. If you're interested in the financial impacts of caring and the sorts of things you might advocate for there, that's going to be table 15 right down the back with Irene. And finally, if you're interested in advocating for greater inclusion of the voices of carers in reform work and policy and decision making, that's going to be with Karen from the Queensland Mental Health Commission down the back as well. So I invite you to choose your area and make your way to the relevant table. If there's multiple tables for the topic you're interested in, see if you can kind of spread yourself across those tables. And I'll let you know when we have 5 minutes to go at the end of our discussion.